Well, vaccine maker Pfizer is pushing ahead on something few countries are planning right now, a third round of vaccinations. The Pfizer-BioNTech shot has been the backbone of Canada's vaccination rollout, the two-dose vaccine, a big part of programs in both the U.S. and Europe as well. But now Pfizer is looking to get the green light from American regulators for booster shots. Now, that request is again highlighting the disparity between the world's richest and poorest countries, though. Many developing nations still struggling to pay for vaccines, and their supplies fall far short of what they need to even do a first round of shots as new COVID-19 variants emerge. So for more, let's go to Washington right now. Farah Morali standing by with our coverage on the story. So Farah, let's talk about this. Pfizer, why do they say they need a third shot?
So, Michael, what we're hearing from the company's chief scientific officer is that they've studied boosters and that their early data suggests that a third shot can generate a much higher level of antibodies to protect against and to fight against COVID-19. And we're talking a 5 to 10-fold increase after a third shot compared to after just 2 doses of the vaccine. Now, what the company is saying is that obviously the Pfizer vaccine protects against COVID-19 and its variants, but that antibodies can sort of wane after 6 months. It says that the data that it looked at was from the country of Israel, and that what it noticed was that there was a dip in the effectiveness of the vaccine, and it attributed that dip to infections that were in people who were vaccinated early, so in January and February. Now, Pfizer notably has not released this data. It says that it will, but it's now saying that in August it will ask the U.S. Food and Drug Administration to authorize emergency use of a third dose. It says it's already been contacted by countries in Europe as well about booster shots.
So what could that mean then for Canadians? Could we see another round of vaccinations here as well, Farah?
Well, the thing is, Michael, is there isn't scientific consensus on whether a third shot is really needed. In fact, here in the United States, the US FDA and the Centers for Disease Control and Prevention issued a joint statement saying that Americans who are fully vaccinated don't need a third shot right now. And we also heard from, the WHO yesterday. They weighed in on this idea of booster shots, pointing to, the number of people around the world who haven't been able to access a vaccine at all, people who have not had any shots, that perhaps we should be thinking about vaccinating them before we start talking about giving people booster shots. And that's a sentiment that's shared among many doctors in Canada, saying that we should be trying to vaccinate as many people as possible before talking about booster shots. Meanwhile, there are some health experts that say, well, if we have the supply, we should maybe think about giving booster shots to people who are immunocompromised, people who are elderly, maybe people in long-term care homes. So that debate is going to be playing out, but we know the official word from NACI, the National Advisory Committee on Immunization, is that it's still looking at this data and will decide whether or not we will be getting third shots.
Okay, Farah, thank you for that. Appreciate it. Farah Morali in Washington.